Hi, everyone. So my name is Thandi, and I am one of the co-founders of Skinterest. And our mission is really to empower patients by breaking down the barriers to care that exist in dermatology while improving health outcomes. So a little bit about me. I grew up in between East New York and Brooklyn, which is predominantly Black, and Coral Springs in South Florida, which is predominantly white. And the one thing that these two communities have in common is that they both have a population a little over 100K, right? But if you were to do a quick Google Map search, you would see that there are no dermatologists in East New York, and there are more than 5 in Coral Springs. And there are communities like East New York across the United States with high populations of people of color, but no dermatologists in sight, right? So they are often left underserved or unserved. And this is a problem. In fact, in 2017, there was a study published in JAMA Dermatology that said you need at least 4 dermatologists per 100,000 people. So we decided to leverage telehealth and our background in translational medicine to create a telehealth enhancement tool. Our solution acts as a toolkit for patients to monitor and communicate their skin progress with their physicians more consistently. We take a data-driven and personalized approach to address barriers to care, such as lack of access. And the thing that really sets us apart is that we focus on continuity of care during each part of the patient journey. And that's super, super important because chronic skin conditions like eczema don't have a cure and have to be constantly monitored. So we're tapping into the teledermatology market, which is expected to be around $8.6 billion by 2024 with an annual growth rate of 8.7%. And our customers are the leaders managing innovation at health insurance companies and are really looking to maximize reimbursements and reduce high cost claims. Based on our research, we see that health insurance currently are spending between $10,000 and $20,000 a year for patients with chronic skin conditions like eczema. So we want to save them money while improving health outcomes for people of color. And that's why we chose to go with a value-based care model, because we know insurance companies are really focused on cutting waste from their work processes and lowering operating costs so that they can improve quality for their patients. And so as it stands today, we have received some non-diluted funding in the form of grants, and we're building out our community of supporters and early adopters. And we are a team with diverse expertise who came together because of our alma mater at City College of New York. And we know we're the right team because we have firsthand experience with the problem that we're really trying to solve. And so right now, we are in the product development stage. We are currently testing out our MVP and refining our user experience and our user interface. So we really invite you to come join our community, try out our MVP, and really help us get the word out so that we can iterate and be the change that we want to see within the dermatology field. So I'm going to stop sharing right now, and thank you so much for everyone's time.
Fantastic. Thank you, ladies. And very, very quickly, are you able to chat in a couple of seconds about how users can think about using your platform both before and after a crisis?
I can take care of that question. Thank you. So as Thandi had mentioned, the target skin conditions that we're focusing on, like eczema and psoriasis, don't have a cure, and so they need to be constantly monitored. And so ideally, when users are using our platform before a crisis, they can track triggers and monitor their skin progress to help them anticipate adverse events. If they do encounter a crisis, they can actually capture the data that's going on with their skin, and the education that's provided to them from the platform can help them better communicate confidently with their care staff. And so after a crisis, they can continue to monitor their skin condition while providing support to sustain health literacy and increase their adherence to reduce the financial burden by incentivizing its use through discounts and deals. And so the idea here is we're basically trying to capture that continuity of care by being that bridge between the provider and the patient that's often missed in between appointments.
Fantastic. Ladies, thank you so much.